Welcome to Healthcare Channel. Cigarette smoking is one of the most common and preventable causes of lung diseases worldwide. Smoking harms nearly every organ in the body, but it is particularly damaging to the lungs. In this video, we will discuss how cigarette smoking damages lungs. First, let's understand how the lungs work. The lungs are two sponge-like organs located in the chest that are responsible for breathing. When we breathe in, air enters the nose or mouth and travels down the windpipe into the bronchi, which divide into smaller tubes called bronchioles. The bronchioles end in tiny air sacs called alveoli, where oxygen from the air is transferred into the bloodstream and carbon dioxide is removed. Now, let's talk about how cigarette smoking affects the lungs. When a person smokes, they inhale a complex mixture of over 7,000 chemicals, including nicotine, tar, carbon monoxide, and many others. These chemicals are harmful to the lungs in several ways. Damage to the airways. Smoking causes inflammation and irritation of the airways, leading to chronic bronchitis. Chronic bronchitis is a condition in which the airways produce excess mucus, causing coughing and difficulty breathing. Over time, the airways can become scarred and narrowed, making it even harder to breathe. Damage to the alveoli. Smoking damages the alveoli, which can lead to emphysema. Emphysema is a condition in which the walls of the alveoli break down, reducing the surface area for gas exchange. As a result, the lungs become less efficient at taking in oxygen and removing carbon dioxide. This can cause shortness of breath and difficulty breathing. Increased risk of lung cancer. Smoking is the leading cause of lung cancer. The chemicals in cigarette smoke damage the DNA in the cells of the lungs, leading to abnormal cell growth and the development of cancerous tumors. Lung cancer can be difficult to treat, and it often spreads to other parts of the body before it is diagnosed. Increased risk of respiratory infections. Smoking weakens the immune system, making it harder for the body to fight off respiratory infections such as pneumonia and bronchitis. Smokers are more likely to get sick and stay sick longer than non-smokers. Decreased lung function. Smoking reduces lung function, making it harder to breathe. Even if a smoker does not develop a specific lung disease, they may experience shortness of breath, wheezing, and a decreased ability to exercise. Chronic obstructive pulmonary disease, COPD. Smoking is the leading cause of COPD, a group of lung diseases that includes chronic bronchitis and emphysema. COPD is a progressive disease that gets worse over time, and it is a major cause of disability and death worldwide. Increased risk of heart disease and stroke. Smoking increases the risk of heart disease and stroke by damaging the blood vessels and reducing the amount of oxygen in the blood. Smokers are 2 to 4 times more likely to develop heart disease and stroke than non-smokers. In conclusion, smoking is extremely harmful to the lungs and can cause a wide range of lung diseases, including chronic bronchitis, emphysema, and lung cancer. It can also weaken the immune system, decrease lung function, and increase the risk of respiratory infections, COPD, heart disease, and stroke. Quitting smoking is the best way to prevent lung damage and improve overall health. Thanks for watching. Subscribe now for more information.